Welcome everyone, welcome back to my YouTube channel. Now we will talk about diphtheria. Diphtheria is an acute infectious communicable disease, and its determinants are agent is Cornylbacterium diphtheria. It has four types. First one is gravis, second one is mitis, third one is intermedius, and fourth one is minimus. And then its frequency is diphtheria is a rare disease in most developed country. It is very rare disease due to the routine children vaccination. It is no longer regarded as public health problem in developed country. In the developed country, it is no longer a health problem because it can be reduced with the help of vaccination. And then we'll talk about the unless treated communicability. Unless treated, the period of infectivity may vary from 14 to 28 days from the onset of the disease, but carriers may remain infected for much longer period. And then pathogenesis. Causative organism multiplies usually in the throat and elaborate a powerful exotoxin, which is responsible for the formation of a grayish or yellow membrane. False pseudo membrane commonly over the tonsils, pharynx or larynx with the well defined edges, and membrane cannot be wiped away. Marked congestion, edema, and local tissue destructions. Enlargement of the regional lymph nodes, signs and symptoms of toxemia, myocarditis, and neuropathy. After that, here are the clinical features. Pharyngeal diphtheria. Early manifestations of sore throat, moderate fever, and malaise, and membrane formation occur in the throat, which may be unilateral or bilateral on the tonsils, uvula, or the soft palate. Membrane is grayish and bleeds on attempted removal, and then stridor, difficulty in swallowing, dull sensorism, prostratium, and a toxic look. Enlarged cervical lymph node in the severe cases, producing so-called bull neck. After that, here is laryngeal diphtheria. Laryngeal diphtheria is it is usually associated with the pharyngeal diphtheria. It may be primary and can occur without membrane. Hoarseness, bradycardia, increasing stridor, respiratory obstruction, restlessness, cyanosis. Death usually occur due to suffocation. And then here is nasal diphtheria, and as well as cutaneous diphtheria, nasal diphtheria. Chronic serious or seropurulent discharge, crusty exudate around the nose, foul odor. Then white membrane on the nasal membrane. After that, cutaneous diphtheria, also called desert sore, and then chronic tropical ulcer and punched out ulcers. Its diagnosis can be done with the Sheik test. The Sheik test as well as throat swab. First of all, we will talk about the Sheik test. The Sheik test has largely been replaced by the measurement of serum antitoxin level by hematogglutination test. What is a Sheik test? It is an intradermal test which tests two things: presence of antitoxins, and second one is state of hypersensitivity to diphtheria toxins. 0.2 ml of the Sheik test toxin is injected into the skin of the forearm as test, while 0.2 ml of the inactivated toxin is injected into the foramen as control. So If you have any query regarding that, regarding diphtheria or anything regarding that, can ask me in comment section. Thank you so much for watching the video.